Welcome everybody in Nursing 1067 video recording of practice question covering documentation and reporting. So today we will be talking about documentation and reporting. As you will see, it will be a huge part of your load during your placement and when you start working. So let's start with the first question. Which of the following is an example of documentation form? Cardex, flow chart, care plan, discharge summary, all of the above. So all of these are forms of documentation, and depending on the place you're working, you might also find more stuff like, for example, worksheet to organize the care provided. So let's talk a little bit about what each one of them is about. So what's a Cardex? This is, you will find in the Cardex all the current orders, like any tests that the patient will be going to do, his diet, hygiene assistance, any ambulation devices he needs for ambulation, the code status, which is very important. So you need to know, for example, DNR or full code and so on. Some places will have flow chart, which is like will include all the routine care, all the frequently documented information like ADLs, activity of daily living, vital signs, intake and output. Some places, most of places will have care plan, which is part of like the permanent record, and it will be always updated to show the patient's need. You will find also discharge summary, and also you can see admission like paper for when the patient is being admitted in the beginning to the unit, and discharge when they're being discharged means they're leaving the place. So all of these are form of documentation and depends on the unit you're working or the place. But the most important rule is whatever worksheet you have, and you as a student, you will have, when you start your placement, you'll have your own paper. For example, you are taking your own notes. Just make sure that you discard it properly. So don't leave any patient's information on any paper that any person can see it. Always make sure that it's discarded properly, and you will find a shredding box or place for you to shred and properly dispose of the information. Okay, what is an acceptable proper way for a practical nursing student to sign the patient's health records? So you will have you saw that it has to be first and last name, and then SPN, which is like a student practical nurse, and GBC. So that's a proper way of documenting. And also, depending on the place you will have your placement at, they will have a login sheet. So you will see on the patient, say file, you will have all the people who are providing care will write their initial, will write their full name and their designation, and you will include yours as first last name, SPN, student practical nurse, GBC for George Brown College. Okay, and also, yeah, one more thing about that. Also, you will have a login, so you will have a computer login that will have your name and unique password that you will pick, and this will, whenever you log into any patient chart, it will show that your name and as a student nurse, and whatever you document also will be under your name under this login information. So be very careful with your login and have your password always protected, and never leave any charts open. Always log out whenever you are done. Okay, true or false? It's okay to use whiteout to correct a mistake on the patient record. So this is a big false. We never whiteout, we never erase, we never use completely obscure the error, all we have to do is to put the line across and initial clearly. It has to be visible. Even the error has to be visible. So if we made a wrong mistake, a wrong entry, what line was using a pen, not a pencil. So a pen lines through the information, and then your initial saying that this is like a mistaken error and so on. But this the information has to be clearly visible. Okay, it's okay for the nurse to record all the care provided to the patient during the day at the end of the shift. So again, that's a big false, because first of all, it has to be recorded. Any care provided has to be recorded as soon as possible. We don't depend on memory. It has to be in chronological order and done as soon as possible, to be recorded, because you never know what's going to happen. So things can happen all of a sudden, and if the care or the provided was not documented in a timely manner, it's not going to be relayed to the next healthcare team member. And if it's not documented, as a rule, remember that big rule, if it's not documented, means it was not done. So very important not to leave it at the end of the shift, but know regularly throughout the day. Part of the duties of the nurse is to document. Okay, all abbreviations are acceptable when recording on patient's charts. So again, that's a big false, because you saw the list of do not use abbreviation by the Institute for Safe Medical Practice. So some abbreviation, lots of abbreviation can be can lead to error. Like for example, HC. It can be meant for half strands and could be mistaken for bedtime. Intravascular. So when we write like international unit. So when we write IU, international unit, another person can see this as intravenous. So like this abbreviation list should not be used. Also, if you remember from math, trailing zeros, so 1.0, we don't write 1.0, we just write 1, for example, milligram, because 1.0, another person can see it as 10, and that's so it will be like tenfold. Okay, next question. Which of the following is a correct way of documenting patient's data? Wound appears to be red. Patient has large bruise on the right leg. The patient is having a usual day. 2/3 bruise on the left forearm. So the answer here is D, because when we are documenting, we want to be precise, we want to be accurate, and we want to give facts. So 2/3, so I did the measurement of the bruise, and we specify the location of the bruise. But look at wound appears to be red. There's no appear to. It's either red or another color. So always facts. Large, we don't use large and small because this is relative. We have to use something specific. Having a usual day, this is a very vague term, or it's like opinion, or some statement could be like biased. So we don't use any of these statements, and you'll see sometimes like documentation saying, for example, patient is uncooperative. No, like we don't say opinion, we say facts. So we can say that the patient refused medication, that's a fact. Or the patient was crying, that's a fact. But we don't say the patient seems depressed. So always stick to the facts. Okay, when documenting in the patient chart, the nurse must include a nursing note related to each of the following: routine care, usual events, doctor's orders, treatment refusal. So must, what should we must include? So the answer here is D, treatment refusal. because routine care and usual events from the name, they are routine. It's what happen every day. So this is not something that needs to be documented. Doctor's orders, it's not the nurse documentation, like part of the nurse documentation. It will be in the doctor will document for himself, like will write or will make sure that his order is placed on the patient chart. But what the nurse need to document is when the patient refused to take the medication, because then the rest of the healthcare team needs to know that, or refuse to do certain procedure and so on. So that's important. Okay. The sorting by exception method of documentation and reporting is most appropriate and useful for which of the following healthcare settings: acute care facility, outpost nursing station, primary healthcare clinic, long-term care facility. So sorting by exception, the answer here is what is long-term care facility. Because what happened with sorting by exception, we are documenting something abnormal or a significant finding, anything other than like exception to the norms. And you will see that mostly in the long-term care. In the long-term care facility, more or less it's a chronic condition. That's like what's happening every day is more or less the same, unless something comes up. So this is what we call sorting by exception. So let's look at the different other methods of documentation. So for example, if we have narrative, this is a traditional one. So each one on the healthcare team makes the notes in separate section, and it's all on the patient chart. So that's narrative. That's more traditional way. Another way is source records. So each discipline has their own section. So for example, physiotherapy will document what they are doing with the patient. The dietitian will document, and so on. So this is source records according to what the information is coming from. Another way of recording could be case management and critical pathways. So here we have a multidiscipline treatment plan that outline like different intervention required for the treatment of the condition. So that's case management. And so all of these are ways of documentation. Okay. So that's the end of our recording for today, and see you in the next